A colonoscopy is a common procedure to check the health of your colon. A colonoscopy can find the cause of problems, such as changes in your bowel movements, bloody stool, belly pain, and weight loss, and it can find colon cancer early when it's most treatable. The colon is commonly known as the large intestine. It's a hollow tube that runs between your small intestine and your rectum. The food you eat travels through your colon where nutrients and water are absorbed. The leftover waste becomes stool that exits your body through the anus. Your colon is shaped a bit like an upside-down letter U with a tail at the end. The part that travels up the right side of your abdomen is called the ascending colon. As it crosses the body under your liver, it is called the transverse colon. And the part that turns and goes down, the left side of your abdomen, is called the descending colon. The sigmoid colon bends back toward the middle of the body and down into the rectum. The lining of the colon can sometimes have problems. It may have ulcers or sores that bleed. It may have areas that are inflamed, and it may have small growths called polyps. All of these can cause symptoms such as pain or diarrhea, or be signs of cancer. Most healthcare providers recommend that people have a colonoscopy when they turn 50, and again every 5 to 10 years after that. Before colonoscopy, your healthcare provider will explain the procedure to you. He or she will give you instructions on how to prepare. Be sure to tell your healthcare provider about any medicines you're taking, prescription and over-the-counter, as well as any supplements. You'll need to empty your colon of all solid material before the procedure. This is called a bowel prep. You may be told to only have clear liquids for 1 to 3 days beforehand. You should not drink liquids with red dyes. You can have water, coffee or tea with no cream or milk, clear broth, sports drinks, gelatins, and strained fruit juices like apple juice. You will also have to drink a special solution the day or night before the colonoscopy. This solution helps clear your bowel. It's a strong laxative. You'll want to be near a bathroom after taking it. Your healthcare provider may also prescribe you pills or anything. It's to help with the bowel prep. Tell your healthcare provider if you are unable to complete any part of the bowel prep, he or she may have to reschedule the test. If your colon is not completely clear, your healthcare provider may miss a problem. What to expect? A colonoscopy takes 30 minutes to an hour. Before the procedure, you'll be given a sedative to make you relax or sleep. You'll lie down on your side, on an exam table. Your healthcare provider may monitor your vital signs. During your colonoscopy, your provider uses a special flexible tool, called a colonoscope. The tip of the colonoscope is inserted into the anus. As it's moved into the rectum, air will flow into your colon to help it expand. If you were awake during the procedure, you may feel some cramping or have a feeling like you need to have a bowel movement. You may be able to watch the video screen and see the inside of your colon. If you have polyps in your colon, your provider may use special tools inside the colonoscope to remove the polyp. A sample of tissue may also be taken to test in a lab. This is called a biopsy. After the test, you'll need to rest until the medicine wears off, then you'll need someone to drive you home. You might feel sleepy for a while. After you get home, you may also have a lot of gas. You'll get your results within a week or 2 after the test. Your healthcare provider will talk with you about them. The most frequent complications after colonoscopy include bleeding and perforation. Most bleeding incidents involve patients who have had polyps removed. Any bleeding or hemorrhages that occurs during the colonoscopy can be immediately treated by the doctor. It's possible that you bled slowly for up to 2 weeks after the treatment. A second colonoscopy can be used to diagnose and treat delayed bleeding by the surgeon. Surgery may be required by the doctor to treat perforation. You can usually eat whatever you can tolerate after the procedure. Some people start with small, bland meals. It is normal to be flatulent and experience gas pains after the procedure. Walking and moving around may help to ease any mild pain. Thanks for watching. Please subscribe and support us to learn more. Thank you.